I yield.
President.
The senator from Maryland.
Mr. President, first I want to thank Senator Durbin for his comments about the policy of repealing the Affordable Care Act and not knowing what comes next, the impact it's going to have on people in Illinois, and I'm going to talk about people in Maryland, of similar letters that I have received, that people are going to be adversely impacted. I want to share with my colleagues a conversation I had with the Secretary of Health from Maryland. Maryland has Governor Hogan, a Republican governor, and his Secretary of Health met with me several weeks ago to express his concern if the Affordable Care Act was repealed and the impact it would have on the people of my state of Maryland. Now, what I heard from the Secretary of Health of Maryland, it was similar to what I heard from many of the healthcare stakeholders, from the Hospital Association to physician groups to healthcare advocates to ordinary Marylanders who have contacted me about concern of what happens if we see a repeal of the Affordable Care Act. Let me just give you some examples as to how the Affordable Care Act is working in my state, and as Senator Durbin indicated in his state, the uninsured rate in Maryland has dropped from 12.9% to 6.6%. That's about 50% drop in the uninsured rate. Now, Mr. President, that benefits all Marylanders, all Marylanders. Yes, 400,000 Marylanders now have health coverage who didn't have health coverage before. And for those 400,000, that's a big deal. That means they can see a doctor and get a physical examination. If they're ill, they can get treated and know that there's doctors and hospitals that will want to take care of them because they have third-party reimbursement. They no longer have to show up in emergency rooms because that's the only place they could get to. They can now go to a doctor and get a physical examination. But, Mr. President, it benefits more than just those 400,000 Marylanders who, thanks to the Affordable Care Act, have health coverage. It affects all Marylanders because we no longer have the amount of cost shifting of those who have health insurance paying for those who don't have health insurance because they use the system and don't pay for it. That dislocation has been dramatically changed in my state. So all Marylanders are benefiting from having 400,000 Marylanders now that have health coverage. But it goes beyond that. Many of Marylanders who had health insurance didn't have adequate health insurance. They had pre-existing condition restrictions. They had caps on their policies. It didn't cover preventive health care. They now have quality health coverage. All of that is at risk. All of that's at risk. Because what we're talking about doing, as I understand correctly, and quite frankly, I'm still trying to figure out what the Republicans are doing on the Affordable Care Act, but if I understand it, they're going to repeal it. And they're not going to tell us right now how they're going to replace it. So everything that's included in the Affordable Care Act is at risk. Now, I'll give you one more example on costs, because I think this is an important point. Under the Affordable Care Act, if an insurance company wants to increase its rates by more than 10%, there's certain procedures they have to go through, certain public disclosures. We have a much more public process. But the number of claims of those who wanted to increase their policies by over 10% have dropped from 75% before the Affordable Care Act to now 14% nationally. We've seen one of the lowest growth rates in health care costs in modern history. And yes, the Affordable Care Act has helped us do that. Why? Because individuals who had insurance now have coverage for preventive health care and are saving us money. And those who didn't have health coverage now have health coverage and they're seeing doctors and they're saving us money. Because if they have a disease that's being caught at an earlier stage, it's being treated in a more aggressive way, and they're saving more intense health care costs. All that is benefiting the people of Maryland and our country. Senator Durbin mentioned several people in his state, a person in his state, and letters. I want to talk about people in Maryland who I've talked to over the last several years about the impact of the Affordable Care Act. and why they are so concerned about the policy now of repealing the Affordable Care Act. I want to go back to 2007. That's a date that Marylanders know very well. I'm going to go back to a 12-year-old, DeMonte Driver. DeMonte Driver is a 12-year-old who lived about 10 miles from here. His mom tried to get him to a dentist, but he had no insurance coverage. And he couldn't find a dentist. She couldn't find a dentist who would take care of him. DeMonte Driver needed about $80 of oral health care. He had an abscessed tooth that needed to be removed. It would have cost $80, and he couldn't find care in 2007 in the wealthiest country in America. As a result, his tooth became abscessed and went into his brain. He had thousands of dollars of health care costs, and he lost his life. As a result of that incident, I, along with other members of Congress, took up the cause of pediatric dental care to make sure every child in America had access to pediatric dental care. That's included in the Affordable Care Act as an essential health benefit. Before the Affordable Care Act, very few health policies included pediatric dental. And therefore, families were at risk as to whether they would actually use dental services or not because they didn't have the money to pay for it. That was changed under the Affordable Care Act. Mr. President, that's at risk. That's at risk because if I understand what is being suggested here, we're going to repeal the Affordable Care Act and the essential health benefits. We can't allow any more tragedies like the DeMonte Driver in America. And yet we are putting our children at risk if we repeal the Affordable Care Act. There was another provision that I worked very hard to get in the Affordable Care Act that I think is extremely important. We now have a National Institute of Minority Health and Health Disparities at the National Institutes of Health. We have agencies that deal with minority health and health disparities in all of our healthcare agencies, thanks to the Affordable Care Act. That means that we are now acknowledging that historically we haven't done right for minority health in America. We look at a lot of the research dollars, they weren't spent in areas that minorities are more impacted by. We see that access to care in certain communities are much more challenging because of minority status. We are looking at these issues and taking action. The Institute sponsored a study in my home city of Baltimore, and that study showed that depending on what zip code you live in, your life expectancy could be as different as 30 years, a generation. Just your zip code. We're taking steps to change that in Baltimore, thanks to the National Institute and the Institute on Minority Health and Health Disparities. Are the Republicans telling us that is not needed anymore? That we're going to repeal our efforts to look at minority health and health disparities? That to me is unconscionable. And yet, if I understand correctly, that is the course that we are going to follow. Mental health parity, another area that we've talked about at great length here. We know that we still have not reached that goal to make sure that mental health receives the same attention as any other health need. But in the Affordable Care Act, we did amazing things to expand access to mental health and drug addiction. By expanding the Medicaid population, we have 1.6 million Americans that now have expanded coverage for mental health and substance abuse. Mr. President, we've had great discussions in this House, and we're very proud of the Cure Act, where we expanded coverage for drug addiction. And now the Republicans are talking about taking a major step backwards by repealing Medicaid expansion that allows access to coverage for mental health and drug addiction. To me, again, this is something that is just unthinkable. And yet, we're moving in that path by the legislation that's before us. Let me share with you a letter I received from Lillian from Baltimore. In 2008, she lost her job. She has a history of abnormal mammograms. She couldn't get coverage. That's her inability to get an insurance company that would cover her because of the pre-existing concerns. The Affordable Care Act, she wrote to me, has worked. I have coverage, no pre-existing conditions. No longer being a woman is considered a pre-existing condition in America. Are we now going to turn our backs on the women of America and allow these discriminatory practices that existed before the Affordable Care Act to come back? I'll tell you, I'm going to fight to do everything I can to make sure that doesn't happen. And I would hope my colleagues on both sides of the aisle would feel the same. But you're marching down a path that puts women at risk, that put Americans at risk. We know about the circumstances of caps that were in the laws before the Affordable Care Act. What do I mean by caps? That's in the maximum amount that your health insurance policy will pay you. 2.25 million Marylanders had caps on their policies before the Affordable Care Act. Not just the 400,000 new people that have come into the system. 2.25 million Marylanders are impacted if we eliminate the protection against arbitrary caps. And the tragedy about caps is when you really need coverage, that's when you are impacted. You get insurance to cover you. You discover you have cancer. It's extremely expensive to treat cancer in an aggressive way. And all of a sudden, you're in the middle of treatment and you reach your cap. What do you do? What do you do? There are real live examples before we passed the Affordable Care Act. We're going to go back to those days? The United States of America? That's what repealing the Affordable Care Act means for 2.25 million Marylanders who are being put at risk. Rebecca from Baltimore told me about her daughter, Eva, 18 months of age, has severe congenital heart defects. It's gone through numerous operations. If caps are in place, she cannot get adequate care for her 18-month-old daughter. These are real live examples of people who are impacted by the Affordable Care Act. She also told me, thank you for the 26-year-old provision where you can stay on your parents' policy. At least she knows that Ava will be able to stay on her policy until 26. I heard from Nicole, who's a student at Towson University, 22-year-old. She couldn't get affordable health coverage, was able to stay on her parents' policy. That's an important provision being repealed by the Affordable Care Act. I helped work on the provision in the Affordable Care Act that provides preventive care coverage, immunization, cancer screenings, contraception, no cost sharing. Mr. President, this saves money. Preventive health care saves money. It makes our healthcare system more cost effective. That's why we decided to put a focus on preventive health care and expand it dramatically. 2.95 million Marylanders benefit from the preventive health care requirements of the Affordable Care Act that's included in every health policy. That will be repealed, if I understand correctly, from what the Republicans are attempting to do on their repeal of the Affordable Care Act. And we don't have a replacement. We don't know what it's going to look like. It's not easy to figure out how to put the pieces back together again. And there's a provision in the Affordable Care Act that deals with prevention and public health funds that provides dollars to deal with some of the real challenges we have out there. Obesity, tobacco abuse. My state's getting funds so that we can deal with healthy eating that will not only be a better quality of life for those who have weight issues, but also lead to a more cost-effective healthcare system. Gone with the repeal of the Affordable Care Act. Let me talk just a moment about health centers, because I know that we made that a priority in the Affordable Care Act. Qualified health centers are centers that are located in many cases challenging communities where it's hard to get doctors and hospitals to locate, and we provide access to care of people who have limited means. The Affordable Care Act did two things that are extremely important in regards to health centers. First, it provided some significant new direct resources for those programs. And secondly, because they're in challenged neighborhoods, they have a much higher number of people who have no health coverage that go into these centers. and therefore their third-party reimbursement's much lower than other health centers that are located in better neighborhoods or more affluent neighborhoods. The Affordable Care Act has worked in expanding dramatically the capacities of these qualified health centers. We have 17 that are located in Maryland. I could talk about all of them, but the Greater Baden Medical Center I've been to several times. It's located in Prince George's County. They also have a center in St. Mary's County. Been there many times. I've seen their new facilities, thanks to the Affordable Care Act. I've seen their ability to provide mental health services and pediatric dental care, actually adult dental care also. They provide those services to the community, thanks to the Affordable Care Act. And they told me in the very first year alone of the Affordable Care Act that they were able to reduce their uninsured rates by 20%, meaning they get a lot more money coming in and they can provide much greater services. All that is gone by the repeal of the Affordable Care Act. I can't be silent about that. This center is providing incredible services. It's one thing to have third-party coverage. It's another thing to have access to care. And we provided both in the Affordable Care Act. We're not going to go back. I heard Senator Durbin talk about Medicare, and I just want to underscore this. This is not just about those under 65. It's about our seniors. It's about those on disability that are covered by Medicare. We heard about the donut hole. We all understood that. We were getting numerous letters from people who fell into that donut hole. Guess what? Those letters are tailing off dramatically. Why? Because the Affordable Care Act closes the donut hole for prescription drug coverage. In my own state of Maryland, 80,000 Marylanders in 2014 benefited by the Affordable Care Act and better coverage for prescription drugs, amounting to $82 million, averaging over $1,000 per beneficiary benefit, those over 65 on better coverage for prescription drugs. You repeal the Affordable Care Act, and seniors all of a sudden figure they have to pay another $1,000 a year for prescription drugs. In my state, they don't have the money to do that. You're going to hear again about prescription drugs left on the counter at the pharmacy because of the repeal. And guess what? It even does more than that. The Affordable Care Act provided greater solvency for the Medicare system. I've heard my Republican colleagues say we're not going to do anything hurt Medicare. Repealing the Affordable Care Act hurts Medicare. It hurts the coverage. It hurts the solvency. I don't want to be part of that, and I would hope my colleagues don't want to be part of that. And yet repealing the Affordable Care Act does that. Let me talk about just a moment about affordability. Because there's one thing to have coverage, there's another thing whether you can afford that coverage. You know, we heard all these stories about the increased premiums, and we know, of course, that the insurance premiums in America have gone up at a slower growth rate than they did before the Affordable Care Act. That's a fact. But we do hear about the individual market within the exchanges and how that's gone up by a significant amount, mainly because of the way that it was originally rated. We've heard about that. But perhaps what many people don't know, in my state and around the nation, 75% of the people who qualify for private health insurance within the exchanges are eligible for credits. In other words, we're helping them with the affordability of their health care. In my state, that was $200 million a year for Marylanders to help pay for health insurance. Gone. Gone with the repeal of the Affordable Care Act. That's just wrong. I received many letters from small business owners. And one of the proud parts of the Affordable Care Act is that it helped our small business owners. Why? If you ran a small business, you wanted health insurance for your employees because you want to keep them well, you were discriminated against before the Affordable Care Act. You didn't have a big pool. And God forbid one of your employees gets really sick during the year, your insurance premiums go through the roof. That's what was happening before the passage of the Affordable Care Act. Are we going to go back to those days where we tell small companies that you really can't get health insurance because if someone gets sick, you lose your policies, basically? That's what we're talking about. Annette of Bel Air, Maryland, wrote to me, and she said she has saved significant money as a small business owner as a result of the Affordable Care Act. Tim from Laurel, Maryland, told me in his small business, You save $7,000 a year thanks to the Affordable Care Act. And the reason is simple. You have broader pools. You get the same type of rates larger companies get now. You lose that with the repeal of the Affordable Care Act. And Mr. President, let me just tell you one of the tragedies of this that will happen immediately, affecting America's competitiveness and entrepreneur spirit. We know that a lot of people who work for big companies have great ideas and they want to start out on their own. I've seen that over and over again in the biotech industries of Maryland. I go down the 270 corridor, 95 corridor, I see small entrepreneurs who used to work for one of the giant defense contractors, and now they're pulling out and coming up with new ideas, doing things in a great way. That's what makes America the great nation. That's how we create jobs and how we deal with innovation. Now, here's the situation. You're a 30-some-year-old, ready to leave that company and go out on your own. Your spouse has cancer. What do? You're not going to be able to get coverage. You're locked into that job. That's a consequence of the repeal of the Affordable Care Act. We're dealing with real people and real people's lives. And it's irresponsible to repeal the Affordable Care Act and not tell that young entrepreneur what he or she can expect. That's what's at stake here. One last point I want to talk about, and that's the Patient's Bill of Rights. I helped draft the Patient's Bill of Rights. It's not easy to pass the Patient's Bill of Rights. We were able to get in the Affordable Care Act. We're able to get in the right that if you go to an emergency room and under a prudent layperson standard, that you did the right thing, you find out that you didn't have that heart attack even though you had chest pains, and you wake up the next morning and find out that your insurance company's not paying the bill because you didn't have that heart attack. Well, we changed that in the Affordable Care Act. Are we going back, eliminating those protections, the right to appeal decisions? Are we going to repeal that part of the Affordable Care Act? Are we going to go back to medical loss ratios where insurance companies can make obscene profits and not rebate those excess profits to their policyholders, that we have millions of people receiving rebates today? All that's gone with the repeal of the Affordable Care Act. Mr. President, I could go on and on, but I see my colleague, Senator Keynes here, and others who want to speak on this issue. Let me just conclude on this. This is the wrong way to go about this. I heard the leader say that, for 6 or 7 years, Democrats have been trying to work with Republicans to make the law even better. We've never passed a major law that didn't need to be revisited. We understand that. We've been working to try to improve the law, not repeal it, improve it, build on it, make it better. And we've gotten no help from Republicans, not any help whatsoever. Republicans have blocked efforts to improve this law. Instead, they're stuck on this repeal without knowing what the replacement's going to be. That's wrong. We should be working together to improve our health care system. But to pass a repealer, to put Americans at risk, to lead to uncertainty, which will lead to insurance companies abandoning the market, giving consumers less choice rather than more choice, to hurt millions of Americans is wrong. And I urge my colleagues to reject this approach. I yield the floor.
Senator from Virginia.
Mr. President, I ask unanimous consent